to do is we're going to move to public testimony. I'm going to have public testimony for about 30 minutes until 4:10. I'd ask each of these presenters, because I think we have almost 30, so we won't be able to get to everyone. If you would try to keep your comments to 1 to 2 minutes and make one point, and then we'll go to another citizen, okay? Karen Clay, followed by Martha Baker.
Thank you for this opportunity to speak to you today. My son Michael was diagnosed with a neuromuscular disease when he was 9 months old. The doctors told me he wouldn't see his first birthday. He turned 32 just a few weeks ago. Having a child with disabilities is not a choice. When my Michael was in high school, his principal fell off a roof. In a fraction of a second, his life was changed forever. Disability is not a choice. Technology and healthcare have played major roles in my son's life. Through medical breakthroughs, advancements in medical care, and the fine doctors that have treated him, he has lived longer. When my son got to the age he could no longer receive care through traditional insurance, his only choice was Medicaid. According to the AARP report Valuing the Invaluable, in this country, 1 in 4 of us over the age of 18 is already caring for a family member or a loved one with a chronic illness or a disability. 1 in 4. The impact on a family can be devastating. The expansion of the Affordable Care Act would protect every family in the state of Florida, whether it is that one wrong step off of a ladder, a car accident, or a gut-wrenching, life-altering diagnosis of a child. Medicaid is more than a safety net. It is a lifeline. Through the home and community-based services and consumer-directed care waivers, Floridians are able to remain at home and at less cost than in nursing homes, hospital care, or other more restrictive environments. The expansion of Medicaid would provide services to the 20,000 plus Floridians on a waiting list, and not at the expense of services cut to those already receiving them. As I had mentioned, technology has also had a major impact on my son's life. When he needed to be intubated and then trached, ventilatory support has enabled him to live at home and have a meaningful and productive life. For him and many other vent-dependent Floridians, if he could not be cared for at home, there are no facilities in the state of Florida that will take a vent-dependent patient that is not weanable. His only other option would be hospitalization, a horrible place to live, even though we like hospitals, and at a much higher cost. A Medicaid waiver has made it possible for him to live at home, being cared for by those who love him most and know him best. This is one of the few choices he has been able to make in his life. Let it be your choice, the choice of this legislature, to choose the expansion of Medicaid so that tens of thousands of Floridians with disabilities will have a choice to live at home with their families, to remain in communities where they can lead meaningful and productive lives. My son has asked me to ask you one question. Where would you rather live? Thank you.
Thank you, Ms. Clay. We appreciate your sharing your experience with us today. Next, Ms. King, followed by Dr. Morris from Tampa, and then Jeannie Vincent, if you could be on deck after Dr. Morris.
Good afternoon, Chair, Senators. Thank you very much for having me today, and I have a brief story to tell you. It's not, well, it's a story of my family. The story is over, so I guess I'll start at the end. In 2006, it was April, it was my first year teaching, it was spring break, and I was hoping to enjoy my first actual break because it's my first year. If you know any teachers, that's an incredibly busy time. But this particular morning, April 11th, 2006, I woke up to see my father dead on my living room couch. He had been diagnosed in the mid-90s with type 2 diabetes. In '99 was diagnosed with heart disease. Also in '99, his business partner took everything and left and was never heard from again. And so over the years, my dad was in his 50s. He died at 58, was not able to find full-time permanent employment. I offered to have him stay with me while he built up his business again, which had actually started. He was getting checks and clients until that April. I urge you to expand Medicaid, which could help families like mine. My daughter lost her grandfather at only 6 years old. He was not able to walk my sister down the aisle. And he never met my niece, my nephew, and the little one that my sister-in-law is on the way. So please expand Medicaid for other families. They don't have to experience what we did. Thank you.
Thank you very much, and we're sorry for your loss. Next, Dr. Morris, followed by Ms. Vincent.
I'm Dr. Mark Morris. I'm in private pediatric practice in St. Petersburg, and a veteran mountain biker, Senator B. I've got a simple number today, 3. 3 of my patients that would benefit from expanding Medicaid. Bronson is 7 months old, and his parents kind of hover just above the eligibility for Medicaid. We've cobbled together health care for him with charity, vaccines for children, and some out-of-pocket costs. But they would face bankruptcy with the simplest illness, the simplest one surgery, one auto accident. David is a 7-year-old, and his parents also both work, just like Bronson's parents, and they have private insurance, but they depend on Medicaid because David is recovering from a near drowning. So his expenses greatly exceed what his private insurance can cover. And the last patient is Ahel. He's 17 months old. He has a cleft lip and palate, and he's in our medical foster care program because his mother is fighting her own problems of HIV and drug addiction, and she's put him up for adoption. Now, his potential adoptive parents love him so much, but they could not afford to adopt him if Medicaid didn't cover his costs as a medically complex child. So for those 3 numbers, I would urge you to expand Medicaid.
Thank you, Ms. Vincent. Next, we have Paula, it looks like Withouse, if I'm pronouncing that correctly. I'm sorry? Okay, thank you. And followed by her testimony will be Gary Stein, and if Judy Evans from Tallahassee, Florida could please be on deck.
Good afternoon. My name is Paula Woodhouse, and I've come here from St. Petersburg to speak to you. I would like to ask you to go with the Medicaid expansion because the mortality rate for the uninsured is 25% higher than it is for those that have coverage. This is John Thomas Byers. John had insurance when he was working, and he was misdiagnosed. He became too sick to work, and he lost his insurance. He sought out social services and local charities, whoever it was that he could get to give him some help. And because he did not have a reliable diagnosis, he was still considered able-bodied. John applied for emergency Medicaid when it was apparent that he was very sick. He went to the emergency room on September 18th, 2011, where he was, once it was noted that he was self-pay, which I maintain are the 2 most dangerous words in the state of Florida, self-pay. When it was determined that he was self-pay, he was sent home with the instructions to seek outside help because, well, there's not much that we can do for you. Again, he went to social services. He applied for Medicaid. On September 25th, he left our house for the last time and he went back to the hospital, where once again they tried to turn him away because he did not have insurance. The reason he'd gone to the hospital was, on top of the underlying condition, vasculitis, that was misdiagnosed, he had acquired a distended hernia. Again, they didn't see it as life-threatening and figured it could be treated on an outpatient basis. He refused to leave until someone could tell him why he was so sick. 2 days later, he was on a vent, and 2 weeks later, he was dead. You know, the ironic part was that while he was in the hospital, we're still furiously trying to get that Medicaid money. 3 days after he died, I received a letter saying he was approved for Medicaid retroactive to 90 days. The people that did not make him well got paid anyway. I understand that's all the cost of doing business, but the cost we're talking about here on this side of the aisle are lives. Forgive me. It's a very, very close to home for me, and this is the first opportunity I've actually had to tell John's story to people who can effectively make change that other people do not have to go through what we went through. Again, I expect that those that have insurance are under the impression that when you go to the emergency room, poor people go to the emergency room and they get treatment, and that is not always the case. It was not the case for John Byers. Who was John Byers? John Byers was an American. John Byers was the son of a warrior. He was the father of one, the grandfather of 5, my partner for 18 years, the center of our universe, a tax-paying citizen who put into the well from which he was not allowed to drink. But more importantly to you, I would think, was that he was a constituent. Your constituents are dying because they don't have coverage. Again, it's a very personal to me, but it should be personal to you. John was one of 77 people that day that died due to not having insurance coverage, and I understand this room holds about 300 people. Picture these chairs filled with 300 people, all uninsured within 4 days. They will be empty. That's considerable. That's considerable because it's our loved ones that are dying, and there's not much that we can do. Again, health care is a right. It should not be a privilege that's bestowed upon those that have the ability to pay. And I urge you to give this help to everyone. Thank you.
Thank you, ma'am. We appreciate your testimony. Next, we have Mr. Stein, then Ms. Evans, and we'll do our best to get to Ms. Teeter, depending on the cooperation of your fellow citizens, Evans and Stein.
Good afternoon. My name is Gary Stein. I am a resident of Wesley Chapel, which means I am within the jurisdiction of Senator Legg and also Speaker Weatherford. And I've come here today to give you a different perspective on Medicaid expansion and why I would support it. First off, I have a master's degree in public health from the Johns Hopkins School of Public Health. I worked for the Centers for Disease Control for the better part of 2 decades and for the Department of Health here in the great state of Florida for several years. And I need Medicaid. I have a medically fragile family. My wife and kids have a genetic disorder called Stickler syndrome, which made my wife go blind in 2007, just a few days after we got here to Florida. One daughter who's had a retinal detachment and lost of vision, and one daughter who was trached at birth and was literally saved by Medicaid waiver. In 2011, after the downsizing of state government, I was laid off by the Department of Health. I didn't just lose my income and my job, but also my insurance. COBRA was a no-goer because it cost more than my income, and it was just not available to us. Well, thank goodness for the great state of Florida, they had Medicaid for my wife and kids. Now, I'm not disabled or a kid, so I have medically needy Medicaid, meaning I have to spend about $1,500 before anything is covered. That means with this lack of full coverage, which would be fixed by this expansion, forces me to go to ER for care because I can't really afford as a self-payer for primary care. The high cost of health care and the lack of insurance has created this culture of sick care we've heard about, which is not health care. We seek treatment and not prevention. We're reactive and not proactive, which means we don't go to a doctor until we're sick, which has a human as well as a fiscal cost. Now, there's a lot to be said about personal responsibility, but there's three things you need for personal responsibility. First, the means to be able to carry out what you need to do, which is what insurance does. Information, health information, which comes from screenings like high blood pressure, lipids, and cancer, which you get from your primary care physician, and the education to realize that information means that your health is at risk. Well, here's my story. Because of the fact that I was on Medicaid for the medically needy, I didn't go to my doctor, I didn't get my screenings. Just a few days after the last election, I had a massive heart attack, and I was brought to the hospital. And thanks to the efforts of the Florida Hospital Tampa, I survived. And I also thank Medicaid for taking my life. Don't think I'm not unhappy about this, because my blind wife has her seeing eye husband, and my kids have their dad. And I'm in the process of creating a 501c3 that's going to navigate patients away from ERs. That's what I'm going to contribute for this. But instead of having Medicaid have a $200 bill for a doctor's visit and a few tests, what I handed Medicaid was this bill for $200,000 for my care. Now, as a constituent and as a Floridian who cares about public health, I find what I did to the Medicaid budget, terrible. Now, I realize that you have to put a face on these numbers and these policies. So I can tell you that I, in the faces of my family, are those who would be impacted by the Medicaid expansion.
Mr. Stein, could you please conclude so we can hear from Ms. Evans and Ms. Teeter?
Absolutely. I should mention that the only thing that kept me on my couch was my heart attack. But I am up, and I'm here to do everything I possibly can. We know that Medicaid expansion will do three important things for our state: strengthen and save the lives of individuals and families so they can work, reduce the impact of uncompensated care on hospitals, and reduce the impact on our state's Medicaid budget using those federal dollars that I put into all these years. So I ask you, for the sake of not just the 1 million that will be affected by the Medicaid expansion, but for the great state of Florida, please opt into the Medicaid expansion. Thank you very much.
Thank you, Mr. Stein. Ms.